it seems to me that crucial data such as hospitalizations and deaths have been relatively stable and that there's not at the moment a discernible spike in new cases. Is that a fair statement?
Yeah, I think it is, at least here in the United States. And the point, though, to make is that each and every week seems to bring us new surprises with regard to the variants of the virus, and we don't know what those are going to mean. And so, anyone who predicts out right now more than a few weeks in advance as to what's happening with COVID, I think, is on very shaky ground. Having said that, let me say that the country right now, in many locations, is experiencing a challenge unlike anything they had during COVID in terms of hospitalization needs and critical care availability. And that's largely because of the combination of respiratory syncytial virus, RSV, and influenza. And we have institutions all around the country right now that literally are taking care of people with serious illnesses in hallways because that's all they have. Staffing is very, very short. So it just reminds us of how fragile our quote unquote disease care, healthcare system is in this country, and how all it takes is one of these infections to tip the balance. And we're now looking at potentially 3 of them occurring roughly around the same time throughout the country.
Is it true that most of the country has either gotten COVID or has gotten vaccines or boosters, so that most Americans have a fairly decent immunity to this family of viruses?
Well, I wish that were the case. Unfortunately, it's not. And I say that because of 2 things. One is, if you actually look at the level of vaccination in this country, it is a challenge. We rank 71st in the world in terms of countries for level of vaccination. A good example is the fact that we strongly urge people to get this new bivalent BA4, BA5 vaccine, particularly if you're 12 years of age and older, you're eligible for it, because we do have evidence that it is doing a better job than with previous vaccines. And yet only about 12% of the eligible people in this country have gotten that vaccine. So we still are hurting in terms of getting people up to as much speed as we can. We also recognize with these vaccines that as good as they are in potentially preventing serious illness, hospitalizations, and deaths, they still allow for individuals to become infected and potentially transmit the virus. And so we're trying to learn how to live with all of that right now, of the combination of what I would call vaccine acceptance and vaccine effectiveness. And then finally, last but not least, one of the things we're learning about these vaccines is that they wane over time. The protection wanes. And when you add that together with these new subvariants that actually can evade immune protection, that's a toxic combination. And so we don't really know more than a few months out, 4 to 6 months out, just what level of protection will be there from whether you had previous vaccination histories or you actually also had previously been infected. So there's still a lot that we don't understand about this of infection and how to prevent it. And we do know that there are a number of people today who have previously been infected or who have previously been vaccinated who are becoming ill.
It really boggles my mind, as I'm sure it does yours, that we have effective vaccines out there that people don't, and boosters and things that people don't take advantage of.
Bob, it's interesting. We've actually seen a very unfortunate and surely unnecessary change in the number of people dying in this country by their risk category. Early on in the pandemic, the predominance in deaths were largely among the communities of color, people who were in essential working jobs where they went to work every day in grocery stores, frontline locations, because they had to. And then they would come home, often to a multi-generational apartment or home, where they then transmitted the virus. And we saw this to be the huge challenge. Well, now along comes vaccine, except vaccine acceptance is actually really varied tremendously, not just by geographic area, but by who lives in those areas. And today, the number one reason for dying with COVID is, number one, not being vaccinated. And largely it is white populations in middle class or more affluent locations that just refuse to get the vaccine.